Well, good morning. This is Mike Petronas. I'm here with two of our family members from the SMC family. This is Anita and Miss Rise. And we're going to talk to you a little bit about some of the exciting things that are going on at Spring Hill Medical Center and Clinics today, and that is our healthcare plan. Derek and Steve have worked really hard over the last couple months to negotiate some things, as well as work with a new insurance provider to have a tiered plan that we've never had before. We have a partner in Shreveport. They're an associate facility called Willis Knighton. Most of you are familiar with them. Well, in negotiations with Willis Knighton, they will become a Tier 2 facility for us. So what we want to do this morning is just talk a little bit about what those benefit changes will be. And then I've asked Anita and Roz to just talk to us about what it means to them and the benefit change that they see coming to Spring Hill. So first of all, in a Tier 1, that's going to be Spring Hill, our facilities, and some of the things that we're proud to bring to you with zero deductible and zero out-of-pocket cost. A small $20 copay for any primary care visit in our clinic, a $40 copay to see a specialist in any of our facilities, and then outpatient lab, x-ray, including MRI and CT, will be 100% covered at our facilities. The emergency room, in order to provide care from our family to our staff family, we're reducing the cost to the emergency room visit to $40. This will be less than an urgent care facility and certainly less than an ER facility anywhere else that our staff may go. In Tier 2, our Willis Knight affiliate, I'm just going to cover a couple of general points about that. We've lowered the individual and family deductibles and cost shares. And for example, $40 copay for a clinic visit, $55 copay for a specialist, and $55 copay for an urgent care facility out of Willis Knighton, and a $75 copay for emergency facility. And outpatient lab and x-ray covered at 90% after deductible. And then when you get into the Tier 3, which is in-network facilities, the prices increase to be more in line with what you've seen in the past, but there are some savings involved in there. And to just compare what a primary care visit would be, there would be $40 for primary care, $55 for specialist, $250 for ER, and there's a higher out-of-pocket and deductible for both single staff as well as family. And then out-of-network will be at a higher rate, and those rates will be shared with you later today and through next week during our open enrollment period. And Derek will get into more specifics with you. But what this plan essentially does is it brings you home to care within the hospital and our clinics, and it allows you to have an option when you need it to go to Shreveport-Bossier and hit a Willis Knighton facility and have a lot less out of pocket. So I'm very excited to present this today and to share what Steve and Derek have put together over the last couple months. And lastly, I want you to get hot. Our enrollment period is going to be next week, and Derek will be doing that in a COVID-safe environment. He's going to have you do that over the phone, and he'll give you more specifics as we roll that out next week. So with no further ado, I wanted to ask Anita and Roz just to share their perspectives on how they feel about this. Anita's going to talk to you about the family plan, and Roz will talk to you about the individual plan. Anita.
Y'all, I want to start out to say I'm so excited about this. This is going to save us so much money as a family. You know, before my husband and I, we felt like we couldn't put everyone on one plan just because, you know, the cost was astronomical, really and truly. You know, and we always were worried about, you know, he works in the oil field, and we were worried about, you know, if he lost his job, you know, what would happen with his and Elliot's insurance. And so I always was scared that I would have to carry that burden, because that was a pretty enormous amount compared to what he pays. We're just so excited that we're going to be saving that money and just being able to, you know, put that towards other things, saving that towards maybe a house or anything that we might need. And then the coverage is going to be awesome. Just I think our deductible from his plan before was $2,000 per person. And so from what we're seeing on that plan, that's huge, because when we had Elliot at Willis Knighton, with our old plan, I want to say it was over $3,000 just because the deductible was, so high. So that's going to be great, for us young mothers that are having babies still, maybe we'll consider having another one. So that'll be exciting. And, I just really want to say thank you to our senior management for advocating for us and for getting this together and just making this work for us. Thank y'all.
No, thank you, Anita. I appreciate you sharing your story, and I am really, really happy that we're able to find something that meets the needs of our staff. This
We are
is wonderful.
too. It's
Thank you.
definitely going to be life-changing.
Yeah. I love to see young families growing and growing without having to be so much out of pocket. So
Right.
that's great.
Take stress off.
Because we were there, Elena and I were there. You have to go back a few years to go back that far and think about where we were. But it's a real struggle when you're trying to have competing dollars, and with this year with COVID and not having certainty with certain jobs and things like that, it helps you do some family planning. So
Yeah.
I'm thankful for that.
Me too.
Thanks, Anita.
No problem.
So Roz, talk to us about what it means to you, what you've seen so far on the individual plan.
What I've seen so far, I've seen a change in the amount of the pay, of the deductibles and stuff like that I can, provide for myself, that I can go to the doctor now without trying to pay an expensive bill. So yeah, everything's
Because co-pays add up,
right.
don't they?
Mm-hmm.
Yeah, and for family, when you are making a decision on whether you're going to go see the doctor,
Right,
all
right.
the preventive care is going to be covered 100%.
Right.
But if you were making a decision on whether it's the middle of the week or Friday evening, Saturday or Sunday, by having this tiered plan and bringing the cost down in our facilities, you can make a decision
Right.
to either come into our ER or over the weekend,
Yeah.
or
and don't have to worry about expensive pay.
don't have to worry about an expensive cost.
Right.
And having things like lab and X-ray,
Right.
MRI, and CT covered.
Right.
That's also very helpful, don't you think?
That's right.
Yeah. Well, that's good. And Rosalind, when we talk about the cost, it may not be as much of a reduction for individuals from
Right.
An annual cost to the staff member. For a family, it's a significant savings.
It
Right.
is.
From what Derek's showing me, and I'm just going to cheat a little bit here and look at the cheat sheets that Derek gave me. Basically, for a family plan, you'll save as much as $7,500, $7,500 for a family
Per year.
plan per year.
That's awesome.
Um,
And just the
Yes.
savings that you'll get when you go to the ER, back in December of last year, Elliot had RSV. And that's, I don't know if you've ever had a child go through something like that. It is very scary. They can't breathe. And we actually had to rush him to the ER one night. And we went ahead and went to Willis Knighton because that's where his pediatrician is.
Yeah.
And I want to say that it was well over $1,000 just for that ER visit, just for
Wow.
everything. And that's going to be amazing now that we have this new plan.
Yeah.
I can't tell you how amazing.
Well, thank you. Thank you. Well, and so Derek, and Derek's behind the camera right now. I'm just going to say to Derek and Steve, we challenged ourselves this year. We had discussions about the health plan that we tried to move to last year. We weren't content with that. Thanks for being fierce in your trying to find us a better plan, and then also for negotiating with our health partner, Willis Knighton, to work out a plan that benefits the organization. Because when I hear about our staff making a decision and, for example, ending up at urgent care because it's actually cheaper than what we're able to provide our staff, well, I just feel like that's not treating our own staff like family. And so this allows us to have a program where we can bring care back into our facility, where we contain the cost and then share that cost savings with our staff. And so I'm really excited about this. I'm sure I have messed up something with a number or something here, so don't hold me to this. But when Derek gets the booklet later today and he starts sharing that with you, consider what this means and how we bring at least the care for our staff to our facility and allow them to share in that cost savings. And we just want to provide that. And then a couple other things that just paid advertisement. Derek also wanted me to share with the current companies that we're using for our employee assistance plan. We have like for depression help, addiction help, financial and legal concerns, online will preparation. That's also been adjusted, and so get with Derek and Kendall and the team there in HR to ask about those programs, because we want to make sure that we're taking advantage of that. And a reminder that these benefits are for full-time employees only. And then open enrollment is November 30th to December 4th. And again, for safety concerns, we've decided to do that via phone. So please get your questions in early so Derek and Kendall can address your concerns. And thanks again for choosing Spring Hill Medical Center and our clinics as your employer of choice. And we look forward to more progress in the future. Have a happy Thanksgiving.